Hi. Morning. Thank you for joining me here today. It's a crucial time in our nation's history. C'est une période cruciale de l'histoire de notre nation. And as we face the additional challenges that are posed by this unprecedented public health crisis, never has the need for health care been greater. Never has federal support been lower for health care, and never have wait times to get an appointment, to get a result, to get care, to get a diagnostic test been longer. Alors que nous faisons face aux défis supplémentaires posés par cette crise de santé publique sans précédent, jamais le besoin de soins de santé n'a été plus grand. Jamais le soutien fédéral n'a été aussi bas. Et le temps d'attente pour obtenir un rendez-vous, pour obtenir un résultat, pour obtenir des soins n'ont jamais été plus long. Our population is aging. The need for health care was increasing before COVID-19. Our wait times, as measured comparable to 20 years prior, were double and triple what they were 20 years prior, and that was before COVID. Now, we have all kinds of additional needs that have gathered up during COVID that we need to address right across the country. Every single day, 500,000 Canadians are waiting for surgery. They're waiting in pain. They're waiting in fear. There's a fundamental imbalance in the current health funding arrangement. The status quo is not sustainable, and the federal government, which used to be a 50% partner, now funds approximately 20% of all health care costs. And without any changes, that divide's going to continue to grow, and the need for quality, accessible, sustainable health care will increase. Since I became Premier in 2016, I've been urging the federal government, as have our ministers, in particular our ministers of health, to become a stronger partner in funding Canada's health care system. Every Premier across the country, coast to coast to coast, has identified this as the #1 priority. And yesterday it was ignored. I understand this federal government is a minority government. I understand the challenges they face, the temptation to be all things to all people. But the fact remains there are foundational issues that must be addressed in our country, and that will worsen if they are not addressed. I only really want to summarize by saying 3 things about our throne speech yesterday. First of all, we're in the middle of a pandemic, and it is critical that all governments work together, and they have been working together diligently across the country, provincially certainly, but also with the federal government and with municipal governments. And I want to see that continue. But I also want to be clear in my comments, not harsh, but clear. That the foundation matters. Underneath this legislative building, underneath the House of Commons, is the greatest investment that you would make in that construction project, yet it is not visible to the eye. Most people don't appreciate and understand how expensive it is to have a foundation until they reflect upon it. I'd ask the Prime Minister to reflect upon the fact that our healthcare system is foundational to our society. We have seen the wait times escalate tremendously, and they will escalate even more without attention being paid to renewing the federal government's rightful responsibilities as a partner in funding health care. The reason one invests so significantly in a foundation under their home when they are involved in a home construction project, or in their business when they build a building, is because everything rests upon it. Everything depends upon it. And what differentiates us from many other societies around the world is the quality of our healthcare system. And it must be available, or it is not functioning to protect people. And so some may say our efforts failed. I would say the battle may be over, but the war will go on. And the struggle for health care will continue, and Manitoba will continue to lead the way in standing up for available health care. Secondly, What I heard in the throne speech yesterday, repeatedly, from the Governor General reading the prepared text, from the Prime Minister in his address to the country, and from the Finance Minister in her comments in answer to interviewers' questions, was that this is not a time for austerity. I would agree, but I would hope they would understand that this is also not a time for profligacy. Profligacy, reckless extravagance or wastefulness in the use of resources. When in each of their comments reference is made to how cheap money is to borrow, I'm reminded, because I have the advantage of being older than every other premier, of the reality of my background and the lessons I learned as a young man. As I watched moneylenders come to our family farm and tell my father that he could borrow money very, very cheaply. That was in the late 1970s. And many other families around the province had those visits and were told that there was cheap money to be had and lazy equity resided in their property, their home, their business, their farm. I remember that. And I also remember helping families who spent the better part of the 1980s working for banks, not for their own advancement, just to pay interest on their debts. As prime lending rates rose, quintupled in fact, people were put into a very, very desperate situation. People lost their farms. The largest landowner in southwestern Manitoba in the 1980s was the Royal Bank. So I would say to the federal government, right, now's the time to invest in people, but invest with a focus. Invest on the fundamentals. Invest on eliminating trade barriers across our country so we can create jobs together as a family. Invest in infrastructure, shovel-ready and shovel-worthy projects so we can build something together like an outlet on Lake Manitoba to give some people their lives back. Let's invest in health care together so people can get health care when they need it, not sit and wait, not be forced in fear and in pain to wait while their appointment is deferred or postponed, their diagnostic test can't happen, or their appointment with a specialist can't occur, or maybe even their surgery can't happen. Canadians deserve to get health care when they need it, but they can only get it with a partnership that has always existed between the federal and provincial governments. And when a Prime Minister tells me that it's not his job, I say it is. And on this, we have to disagree. I've learned the lessons that perhaps aren't in evidence as a consequence of the throne speech yesterday, that when your foundation is eroding, you fix your foundation. You don't start redecorating the second floor sitting room. Happy to take your questions.
Thank you, Mr. Premier. We'll go to the phone first today from the Brandon Sun. Colin.
Hi, Mr. Premier. Was there anything in the throne speech that you were happy to hear about?
I didn't hear any reference to sick pay, and we went to Ottawa for a number of reasons and had very productive discussions there. One of those discussions I had hoped would have re-emphasized what we've been saying from the start and what we joined with British Columbia to promote and eventually got the support of all premiers to promote, which was paid sick leave for people who have to leave work because of concerns about COVID, supporting family members or they themselves waiting for test results. And I didn't hear any reference to that in the speech. I was disappointed about that. But the speech was a buffet speech. It was a pre-election speech, and so it touched on numerous topics, and obviously among all those topics there's bound to be some things I liked. That being said, what I didn't like is what I've just commented to you on, and I'll continue to comment on that. We need to focus right now. We can't be all things to all people, and we can't afford it. We're already talking about the biggest deficit in Canadian history, and adding to it because interest is low right now doesn't change the fact that somebody has to pay all that money back, and somebody has to pay interest on it too. I give the example. If you're a homeowner in Manitoba right now, it wouldn't be uncommon for you to be dealing with a mortgage, say for example, $300,000 mortgage. I'll talk to you about this now as an example. $300,000 mortgage. If you like the interest rate, you might have locked in your mortgage rate some time ago, and you might be paying a very low rate on your mortgage. But what happens if interest rates start to rise? Okay, if you have a $300,000 mortgage and interest rates rise 1%, you're going to have to make almost $5,000 more when your mortgage comes up for renewal just so you can stay at the same position in terms of disposable income. That's because interest payments aren't deductible from tax, so you'd have to make $5,000, pay the tax on it, be left with enough money to cover another $3,000 of interest. How many families in Manitoba understand that? Quite a few older people do because they've been through higher interest rate times, but lots of younger people don't. I think yesterday's throne speech was written by some younger people who haven't been through higher interest rate times. And I think the run-up on the national debt, as much as it's necessary during COVID, doesn't need to be added to at the expense of us when we're older or our children and grandchildren. And so I'm making the point that we need to focus on the key things right now. We can't just throw money at every single thing. There's my problem with the throne speech yesterday.
In the Prime Minister's address yesterday evening, he mentioned that the COVID Alert app would be key in improving the COVID situation in the country. Is Manitoba getting closer to signing on to that app at this point?
I hope so. I've talked to Dr. Russin, and I'm assured that his officials are looking into this and that they are doing so with focus themselves. Other provinces have already approved the use of the app, and I think the app could be a very important tool in helping us to make sure that we're able to better battle the effects of COVID as cases rise, as they are rising around the world. Sure, not as rapidly here in Manitoba as they are in many jurisdictions, but nonetheless they're rising. And we're concerned that we have the ability to track, to reduce the spread, and to increase the ability, obviously, to follow up and protect others. So Dr. Russin will be available, I think, in a couple of hours to answer any questions you might have more detail on that.
From CJOB, Clay.
Good morning, Mr. Premier. We noticed Prime Minister said last night, and I'll just quote, "It's all too likely we will not be gathering for Thanksgiving, but we still have a shot at Christmas." Excuse me. Thanksgiving is approaching. We're going to ask Dr. Russin this, but do you have any advice for Manitoba families who I'm sure are starting to make plans for Thanksgiving?
Well, Clay, I guess Dr. Russin, I'm sure, will say many useful things that I hope Manitobans listen to. He's an expert on health care, and he's an expert that's earned his credentials. I can only add, as a layperson, that I know it's critically important that when we get together with family, we don't endanger other family members. And so I think we'll have to use our judgment. I'm sure Dr. Russin will be able to give some additional comments to assist us in this. But the point I think that we need to understand is that we're not powerless in this. We have the opportunity to work together to protect one another, and we should make sure we do that effectively and well.
Thank you.
From the Winnipeg Sun, Josh.
Good morning, Mr. Premier. It's Josh Aldridge with the Winnipeg Sun. You referenced wait times across the country going up 2-3-fold over the last 20 years. What are wait times currently in Manitoba, and what were they 20 years ago?
We can get you a detailed breakdown, Josh. Actually, we've commissioned a detailed study to be done, which I'd like to share with you, but it's not quite ready for release yet, by the Institute for Fiscal Studies that's headed by the former parliamentary budget officer, Kevin Page. And the preliminary work that he's done has really impressed me. I was not aware of the tremendous increases in wait times across the country, not just in Manitoba. Here in Manitoba, under our government first term, we're the only province to not see an increase in wait times in significant categories. 9 other provinces saw wait times increase, some very significantly. And the longer trend is really shocking when you take a look at it. You're talking about wait times double, even triple in many categories. Just in the last 3 years, and this is all before COVID arrived, I think I might have a breakdown, something of a minor breakdown here, but I'll get more of it to you. Hip replacement volume increased between 14 and 19 by 32%. Knee replacement volume increased by 33% in that same time period. Echocardiogram volume increased by 35%. So you're seeing massive increases. We've maintained the highest investments in healthcare here in Manitoba of all but I think one other province, and we've done that while holding the line on growing wait times, but we can't hold the line forever. And as demand increases, and those numbers I've just given you demonstrate very clearly it is rising significantly, and with the baby boom population, of course, not getting any younger, I think of Larry Cush over at the Free Press as an example of that, or myself, people who are getting to the time when we are more likely to need healthcare services. It is very important to understand that healthcare demand will continue to rise, and as it rises, we need to have the federal government step up and resume their rightful role as a genuine funder of healthcare, not shrink in their involvement. That's what they've been doing. It has to stop.
A follow-up to that, how has, early on in the pandemic, there were a large number of surgeries that were deferred or delayed or canceled due to the pandemic and visiting or restrictions within the healthcare system. How has that impacted wait times? I know private clinics were brought on board to help handle some of that demand. Where are we currently in terms of wait times on that?
Well, the health ministers recently announced, and you've reported on it, Josh, I won't get into the detail, others can, commissioning out to try to address some of these wait times. I'll just give you a couple of numbers. The increase in volumes for procedures obviously results in longer waits. So in efforts to find efficiencies, we have pursued a number of avenues, and we put additional funding in place, put $10 million in place just last year for reducing waits on hip and knee, and we've actually were able to do 1,000 more hip and knee procedures last year and 2,000 additional cataract procedures. But now with COVID, what has happened is that surgeries had to be delayed, and so what we've seen is a 70% reduction up till recent days from normal surgical activity levels. And so what that means is you've got a further backlog in surgeries and diagnostic services. But again, I'd emphasize this isn't just because of COVID. Like, we've got about 7,000, we estimate, backed up surgeries right now. 22,000 imaging exams were postponed. That's COVID. But prior to COVID, the wait times had steadily increased over a significant period of time, especially in the last half decade. And so this issue, there's a reason that premiers all across all political stripes, this is not a partisan thing, this is a nonpartisan thing. Canadians deserve health care, and premiers, Liberal, NDP, Conservative premiers all emphasize this to the federal government, yet the Prime Minister is, as of yet, has not responded favorably to our unified, unanimous ask for a renewed discussion and a partnership.
From the Canadian Press, Kelly.
Hello. The government said in the throne speech that it would extend the Canada Emergency Wage Subsidy for another 9 months. What does this mean in regards to the Manitoba plans, especially when it comes to getting people back to work?
Well, we're going to continue with our efforts. I'll give you, Kelly, I'm planning to share with you an updated progress report on our back to work wage subsidy programs early next week, I think Monday perhaps. And so I'll be able to give you the detailed numbers. I can only say at this point that the response to our programs from the small business community has been tremendous. And this is really helping to get people back to work here in Manitoba. Longer term, look, COVID is here, it's with us. We're going to have to learn how to deal with it and live with it. But Manitobans want to get their lives back, and part of that is getting their jobs back. So certainly we will continue to work on that here and focus on it. The federal government has offered an extension of the CERB program and some as yet undefined reforms of the employment insurance program. I've emphasized to them in discussions already, and I'll repeat it, that this isn't the time to add additional tax burdens to small business people. These are the people we're counting on as the backbone of our economy here in Manitoba and across the country to take the risks of extending additional capital to employ people. And so we don't need additional taxes on small businesses. That would hurt our recovery.
In regards to healthcare funding concerns, obviously last time with the health accord, there was a cross-country stand against it initially, but Manitoba was the last province hanging on in the end. Have you spoken to your counterparts since the throne speech, and how much hope do you have in a communal effort on renewed conversations about healthcare transfers?
Well, you're right. We were the last province standing, and we will remain so if necessary. I mean, Tommy Douglas didn't drop the torch, but it's fallen in recent years, and we're proud to pick it up and stand up for health care. But I will say that I've been impressed with the unanimity of premiers, again, across all political stripes and coast to coast to coast, working together to stand up for health care together. And although many premiers have been elected since the time you describe, who are taking this very, very seriously, although in past other premiers chose to give up the fight in exchange for offers of support from the federal government in other areas in some cases, Manitoba did not, and we will not. We believe this is something worth standing up for, and we'll continue to do that. And it's my hope that the Council of the Federation, the premiers, are united and remain united on this. We'll have a call this afternoon on the throne speech and other topics, and I will reiterate what I'm sharing with Manitobans today, that it's vitally important that we continue and persevere and are determined in our efforts to preserve health care and restore health care to a stronger status in the country.
From CTV Winnipeg, Stephanie.
Hi there. So you had mentioned about the federal government needing to become more of a partner in healthcare. So is it just, are we needing more funding? What exactly do you need from the feds in order to, I guess, help the healthcare system?
Well, the feds were 50-50 partners at one time in healthcare. They dropped over time to about 25. We had a guarantee they'd remain as a quarter partner. Now they're about 20 in most jurisdictions and sinking. And so that's liable to get worse, not better, with increasing demand. You have increasing demand, not just because the population's aging, though that is one of the key factors. So increasing demand meets lower federal support, means longer waits. There's no way of getting around it. If healthcare is slow, think Trudeau. The reality is we have to get a federal government that will take seriously its role as a partner in funding healthcare. And so we'll continue to persevere in standing up for a partnership with the federal government. Yes, it's expensive. It's expensive not to have healthcare when you need it too. I don't know how you put a price on someone who has a lump on their breast waiting for weeks and then months to get a test result back and finding out that they're stage 3. It's impossible to price the amount of human hardship that's created as a consequence of the delays that are happening right now in this country. But that doesn't mean that they aren't happening. They are happening and they're real, and I want the federal government to recognize that they're real and do something about it, not just talk around the edges. And so the sooner the better. We need a federal government that will partner with the provinces on health care funding, because we pay for our services with real dollars, not with hopeful aspirations and vivid imagery, but with reality. And the reality is it costs to deliver health care, and it costs a lot more if you don't have it when you need it.
And just in terms of the wage subsidy benefit being extended, do you think that the federal government should have done more of a maybe similar model to what you've done here provincially in terms of programs in order to get people back working?
Well, We've created 10,000 jobs for students by partnering with small businesses. The federal government proposed to work with an organization called WE with an untendered contract. That didn't work very well. I think there are things they could learn from Manitoba's approach. But that being said, there are tens of thousands of Canadians that are out of work right now, and it's going to take time for the economy to come back. And so the federal government is quite right in having a program that offers financial support to those folks to help them in the interim period. And we applaud that, and we're partners with them in respect of this. But we also understand that people want to get their jobs back. And so we can walk and chew gum at the same time. We're doing that now by encouraging, through our programs, encouraging the creation of new jobs. And I'll be able to give you an updated report on that early next week in terms of how well that's working. But the fact remains that we need to work together. Federal and provincial governments need to work together to reinvigorate the economy. And there are ways to do that too. One of those is to get rid of these ridiculous barriers between our provinces that get in the way of job creation. We have estimates from the World Bank, no less an authority than their researchers, that Canada is losing $1,500 per household per year because of trade barriers between our provinces. And the federal government could work with us effectively on that. I've urged that, and we certainly have continued to lead the way in our own province by reducing those barriers. But the federal government has more barriers than all of the provinces do, so they need to work on it too. I had good discussions in Ottawa with Dominic LeBlanc, who's now the Minister of Intergovernmental Affairs, on this issue. We know each other, we work together well, and we've worked at that relationship. And I can say that I'm hopeful that the federal government, they mentioned in the throne speech briefly this issue. I'm hopeful that they will work with the provinces on this issue, and I'm prepared, of course, to work with the federal government to assist in any way I can in helping on that.
From City News, Jonas.
Good morning, Mr. Premier. Jonas Gilbart, City News. Just following up on the Premier's meeting you had before the throne speech came out. When you got together with your counterparts, what were the asks directly you were making of the federal government?
Well, there were three main, Jonas, there were three main topics that were raised at and reiterated and reinforced by the premiers being there. And other premiers would have been there if they could. All the premiers wanted to be there. We have a couple of elections going on now, so that was an inhibitor to attendance, of course. Atlantic Canadian premiers are in what they call a bubble, so they can't readily leave without self-isolation on return. But nonetheless, the premiers were unanimous in these three issues. The one was healthcare. I've probably emphasized enough for one press event. The second was on infrastructure and a strengthening of our infrastructure partnerships with Ottawa. The third was on an issue of some great concern, not so much to Manitoba, though we support it being addressed, and that is the issue of not the equalization program. It sounds like the equalization program, but it's basically a fiscal insurance formula that the federal government has frozen. It was frozen some years ago and capped. That doesn't work for provinces like Alberta and Saskatchewan right now with the oil crisis that they're faced with on top of COVID. So we raised each of these issues and had raised them previously, but felt that it was important they be reinforced at the event that we held publicly last Friday.
Thank you for that, sir. And as a follow-up, when it comes to healthcare, there's that old saying, an ounce of prevention is worth a pound of pain. Over the last week, we've seen the call for mask mandates for Winnipeg especially start to amplify. I know this is Dr. Roussen's area of expertise, but can I get your opinion on potential mask mandate for Winnipeg or the province?
My opinion is that we should follow the experts' advice on this issue. Dr. Roussen and I obviously talk regularly, as he does a call regularly with our cabinet and senior officials, and we report mutually to one another. I can just say to you that we freely raise issues here, but we understand that ultimately the recommendations have to be formalized on the basis of public policy. The experts on health policy are the people that should be giving that advice. Dr. Roussen will be available in an hour and a bit to answer any questions that you may have of him, and I'll continue to support him. I would also comment that I've learned this a long time ago in sport, there's lots of outside of Atlantic Canada, we remain, I have those numbers here somewhere and I'll share them with you when I find them. In the meantime, I'll rag the puck. Just take a look at what's happening in other jurisdictions that don't have the leadership of people like Dr. Roussin necessarily. We're 6th among all provinces. That means we're the lowest outside of Atlantic Canada on COVID cases to date. Now, yeah, we had an uptick in recent weeks, and we are not alone in that fact. But we're also not powerless in that fact. So Manitoba's 5th among all the provinces with active cases today. Saskatchewan is lower than us. The Atlantic provinces are as well, but we're behind other major provinces. And in terms of rate of testing, still not quite to the 3,000 I'd hope we get to during the fall. We're over 2,500 now in capacity. We need to get higher. But we're 5th among the provinces for rate of testing. That's to date. North Dakota's half our size. North Dakota's got 8 times our active cases. So it could be worse. If we want to make it better, we follow the doctor's advice. That's how we make it better.
Thank you, Mr. Premier. We return to the room now for one question and a follow. Please proceed.
Premier, you were in Ottawa for 6 working days. I believe you departed on the 15th and you came back yesterday. There was a weekend in there, but there were 6 working days. Did you have meetings scheduled for all those 6 days, or was it a mixture of business and pleasure?
I had meetings for 5 working days I was there, and they were productive and positive and important. We have other provinces that actually maintain offices both in Ottawa and in Washington, D.C. to do outreach. We don't do that, but we do make a real effort to be careful with our travel and expedite relationship building when we go. And so that's exactly what I was focused on doing.
Your staff has refused to provide a list of people you talked to or an itinerary. Could you release that?
Well, I can tell you who we met with. Why don't I do that instead? Met with Canadian Labour Congress. We met with some of these meetings, Larry, were changed to virtual at the last minute. I should mention that as well. Met with Conference Board of Canada. Met with the Institute for Fiscal Studies. And I might miss a couple in here. We met with the Canadian Chamber of Commerce. We met with various senior officials in various government departments. I expect some of them might not want me to name them, but nonetheless, to gather information and to get help us in terms of our strategies, and going forward with more information is helpful. I hope she would agree. We had very productive discussions with the Minister of the Environment. Her deputy was involved in that call. Of infrastructure, I'm sorry, former Minister of the Environment, now in infrastructure, but of course those departments kind of overlap a bit when it comes to things like an outlet. Really good dialogue with the Prime Minister, good discussion with the Minister of Intergovernmental Affairs, and I'm probably missing 4 or 5 meetings, Larry, but the point is I'm very careful about making sure I make maximum use of my time when I travel and when I'm here.
Mr. Premier, what do you think about the fact that although testing lab capacity is up, sampling capacity is insufficient right now? People are waiting for hours. People are complaining that they can't manage their jobs and their childcare responsibilities, and they're very concerned about the winter.
Yeah, I'm concerned about that too. And I know it's not unique to us. We just had discussions with several of the premiers. I'm sure it's going to come up on the call here in an hour as well. I note the concern exists right across the country. There's also the concern, I'm not trying to digress, I think, Bartley, but I'll just add, also, added concern is the issue around sick leave. I'll also be concerned that people are not stigmatized because they'll become less likely to go and get testing. Also concerned when people like the opposition leader advocate that asymptomatic people should get in those lineups. That's going to make it longer for people with symptoms. Not good advice. Bad advice. So yeah, very, very much concerned. It's coming up everywhere. I was interested to have a discussion. This is the benefit of, you know, you can do some things virtually, but the benefit of face-to-face, well, with distancing, is that you can get into more detail. I was very interested to learn about some of the possibilities on other ways of testing that might be less invasive, and also researching that. Other methods, other ways to get testing done. Ontario is looking at expanding into using pharmacies for testing. There are no instant answers. There's concerns about that too. You know, do you want to go into a line in a pharmacy with someone who may or may not be symptomatic? That's could be a danger as well. So there's not an instant answer, but there have to be answers, because as we move forward, and this second wave apparently is reality according to some. Dr. Tam has referenced it. Others have said it's inevitable. No one wants to sit in a lineup for hours on end and wait. But I would also say this, no one wants to wait for hip surgery for months either. No one wants to wait for a test on a lump on their breast for months either. And we can't ignore the reality this isn't all about COVID. COVID is making it obvious that it's also about all the other health concerns that we have. And there are hundreds of thousands of Canadians who need a federal government to step up, not just on partnering on things like tracking and tracing, but all for COVID, though that's important, but also step up and partner on the delivery of healthcare, the funding of healthcare. The delivery is done by the provinces, but the funding partnership we need, like a foundation, may not be visible, but it's vitally important because everything rests upon it.
Minister Van Dal.
Dan Van Del's asking.
Bart gets a follow-up here. Bart gets a follow-up, and then we're done.
I was going to ask the same question.
Well, you both have the same questions, so we better stick to protocol, I guess, Larry, and let Bart ask it, eh?
Minister Van Dal stated he was, quote, unpleasantly surprised, unquote, that there were long lineups for testing here after $100 million was pledged from Ottawa to help with testing. Can you respond to that?
Sure. I'm amazed at how quickly people who we elect from Manitoba to represent us in Ottawa turn around and start representing Ottawa back to Manitoba. Yeah.
He's saying that you're not he's suggesting you're not spending the money that Ottawa is giving. He says, I think our government needs to make sure that when we invest specific dollars in specific health issues, that money is actually spent.
That we get noticed. That's the key problem here. That's the problem Mr. Van Dal has just put on display for you as journalists to note, that when Ottawa invests its money under this government, they want to get noticed when they do it. That's a problem. It's amazing how much you can get done on a team when people stop worrying about who gets all the credit. We haven't got that culture yet, but we can work towards it, and that's what I'm proposing to do. We have premiers from coast to coast to coast who've set aside their partisanship and said, let's work together and let's address the issue of healthcare wait times in this country. We need federal government and representatives from that federal government to adopt that same culture, and then we'll start to make progress. Thank you.
We gave him money for home care and